So, how much does it cost to die? That's an uncomfortable question, but if you want to understand the US healthcare system, it might be one of the most revealing questions we can ask. I'm a doctor, frustrated with our system, out to learn more and share what I learn. And so in the United States, about 1/4 of all Medicare spending goes to people in their last year of life. On average, Medicare spends roughly $30,000 to $35,000 on someone who dies in a given year, compared to about $9,000 to $10,000 a year for someone who doesn't. That's a 3 to 4 times difference. And for many patients, the last 12 months of life actually cost more than all of their health care in the decade before. So this doesn't mean that end of life care is wrong. A lot of it is appropriate, compassionate, and life-saving. But it does raise some uncomfortable questions. Are we paying for care that people actually want, or just what the system defaults to? Are families being forced to make huge decisions in an ICU in the middle of the night with no real roadmap? Are we investing more in machines and hospital days than in comfort, time at home, and support for caregivers? Medicare does cover hospice, but most people don't understand it until it's very late in the game. So to qualify, 2 physicians must certify a life expectancy of 6 months or less, and care shifts more towards comfort than curing the condition. Hospice includes nursing care, medications for comfort, medical equipment, social work, chaplain services, and even short-term respite care for families. It's also far less expensive than repeated hospitalizations or ICU stays. Yet many patients enroll only days or weeks before death, meaning that we often pay for the most aggressive care first and the most supportive care last. Other countries handle this differently. Many invest earlier in palliative care and have clearer pathways that focus on goals of care before a crisis. And some countries also allow medical aid in dying, like MAID in Canada, or physician-assisted dying in places like Netherlands and Belgium. And these programs are controversial everywhere they exist, and they raise serious ethical questions. There's no simple answer. But let me be very clear about one thing. I don't think anyone should ever be denied end-of-life care because of cost. That's not what this is about. The question is whether we're spending money in ways that actually make the end of life better, or whether we're caught in protocol, fear, and a system that treats hospice like giving up. End of life care shouldn't be about choosing less care. It should be about choosing the right care at the right time and for the right reasons. And that conversation shouldn't wait for a crisis. If you've experienced something like this, comment below and share your story.